Hi everyone, I'm Dr. Srikanth, Senior Consultant Pediatrician, Yashoda Hospitals, Secunderabad. Today let's talk about dengue fever and its prevention. So dengue fever is caused by a virus that is transmitted via mosquitoes, typically the Aedes aegypti, and it is a viral fever that typically presents with high-grade fever that is more than 102 to 103 degrees Fahrenheit, and also presents with headache and retroorbital pain, that is pain behind your eyeballs, and also presents with body pains and also with severe stomach pain. So typically it starts off with an incubation period from the mosquito of around 7 to 10 days from the bite, and then presents off with high-grade fever with headaches, and the child's first symptom will be reduced appetite along with fever. And once this happens, the child typically starts with a febrile phase that anywhere lands between 3 to 5 days, and then the child, once the fever crosses the third day, they go into a critical phase. In the critical phase, the platelets drop, the white cells drop, and the packed cell volume or the hematocrit levels of the child increase. During this time, the child may experience severe stomach pain and swelling all over the body, swelling over the face, and the child then typically, after a span of 3 days, if the hydration has been maintained, the child typically improves, which is called the recovery phase. So the diagnosis of the child is typically made from day 2 to day 3 of fever by doing a dengue NS1 antigen and also an immunoglobulin M levels, and by doing a CBP in which the hematocrit rises and the platelet counts drop and the white cells drop to below 5,000. The diagnosis of dengue is mainly by serology, that is the IgM and the NS1 antigen, and also the diagnosis can be made clinically by index of suspicion. During the recovery phase and during the febrile phase, the child may have developed rashes over the body, which also is an index of suspicion for dengue. The treatment of dengue does not include antibiotics because it is a virus. The treatment of dengue is only hydration. So the child has to be hydrated properly. Most of the children do not require hospitalization unless the child is showing signs of severe dengue that includes puffiness of the face or severe pain abdomen, or the child is not accepting orally at all. The treatment of dengue includes, if the child is hospitalized, mostly IV fluids, that is either by crystalloids or colloids, or if it's at home, the child has to be hydrated properly and the child has to be tested for lowered platelet counts and for white cells at least alternate days. The prevention of dengue includes anti-mosquito measures, spraying malathion or like parathion around the area, or the child has to be indoors, or the child has to wear full sleeves just to prevent mosquito bites. Thank you.
Like, comment, and subscribe for more health updates.